I think that fertility is very much underserved for guys, and that's a really kind of a hot topic of discussion right now too. Earlier screening, so guys kind of know where they stand. We used to put all the blame on a woman if she can't get pregnant. We're actually finding out it's about 50-50 split. Typical kind of workup for male infertility will include a hormonal panel, a semen analysis, which requires maybe an at-home test that they can ship, and we get results back through that. Usually some form of imaging like a scrotal ultrasound, and depending on the results, we kind of dive a little bit deeper. So we also have access to adult genetics here, and there are quite a few genetic concerns too that can cause these things, such as cystic fibrosis, Klinefelter syndrome. These are concerns, and sometimes guys don't even know they have it until they're actually facing diagnosis of infertility. Men's infertility in Arkansas is a completely underserved population. We're getting a lot of referrals from outside clinicians because things are not being offered to them, and there's actually not a men's health infertility fellowship trained urologist in the state. The closest one currently is Dallas, edge of Mississippi or so, and down in Shreveport. And so we will get most of the diagnostic workup, and if it's something we can keep in-house, we will do. Other than that, we kind of follow the guidelines, get every single detail, and by the time they go to see them, it's all procedural at that point. So they've already had their genetic testing, we know where their counts are, we've tried some medications maybe or procedural management before they need to go somewhere else to get that definitive procedural care. A really common correctable cause of male infertility is what's called a varicocele, which is a venous dilation within the scrotum. This can be very procedurally managed with an outpatient procedure, and within probably 3 to 4 months or so, we can typically see the sperm counts rise in the ejaculate fluid, which is a very commonly caused, I think it's considered the most common cause of male infertility actually. So by keeping that in-house, we're able to get like an image there and diagnose that, treat it, and then we're getting success stories back, you know, like, hey, like we're 6 months pregnant, thanks so much. I would just say as far as infertility workup goes or advocation, I think that more than likely a female is going to be the first person to seek infertility care. And I think that female physicians or women's health, OBGYNs are getting better at advocating to have the men tested too at an earlier part of this journey. Currently the guidelines say if you've been trying for 1 year, at that point the guy should go get tested. The more current topic of discussion is as soon as you have a concern, you should both be tested at the same time. It should not be one or the other.